Excellency, ladies and gentlemen, as the first United Nations independent expert on the enjoyment of all human rights by older persons, I feel extremely honored to address you on the occasion of this important event of the human right of older persons in long-term care. I should like to express my sincere gratitude to the European Commission and the European Network of National Human Rights Institutions for the invitation and regret that I am not able to be with you in person. Currently, Europe has the oldest population of all regions. By 2015, it is expected to reach 236 million. This represents an increase of 34%. There are many challenges that need to be faced in order to ensure a life of dignity for all older persons, especially those in need of long-term care. As our society continues to age, state will have to solve the complex equation of a rising demand for long-term care, which will lead the increase in cost for social protection system and family, while ensuring adequate access to high-quality care and support for formal and informal cares. The state will also have to take action in order to put an end to abuse, violence, and discrimination against older persons, especially while they receive long-term care. There is not yet an accepted universal definition of the term long-term care. However, according to the General Comment number 14 of the United Nations Committee on Economic, Social and Cultural Rights, it is important to adopt an integrated approach combining elements of preventive, curative, and rehabilitative health treatment. Hence, long-term care should encompass a wide range of service and assistance for older persons who require help with daily tasks and who are in need of medical and social care on a continual basis. Such services include home care, private residence, and private public institutional care. According to United Nations Principle for Older Persons adopted by the General Assembly in 1991, older persons should be able to enjoy human rights and fundamental freedoms when residing in any shelter, care, or treatment facility, including full respect for their dignity, life needs, and privacy, and for the right to make decisions about their care and the quality of their lives. A state has to adjust their current social and health policies to the need for older persons, including services that take into account gender, disability, dementia, and HIV. Older persons are right holders and should be able to exercise their right in all circumstances. Their voice and choice should be heard. A human right-based approach for older people in long-term care, particularly when applied in social and health care systems, will enable us to combine effort and to maximize the benefits available to older persons. I will also increase the human right protection for older persons in long-term care. In this connection, I commend the European Union of the Council of Europe for their work in raising awareness of this important issue. For instance, the joint report of the European Commission and the Social Protection Committee and the project of human rights for older persons in long-term care are positive initiatives that they have been undertaken at the regional level. Ladies and gentlemen, in order to solve the equation, this issue of long-term care should also be seen from another perspective. It is important to prevent older persons from becoming dependent on long-term care. To do so, state should promote active and healthy agents, age-friendly environment, autonomy, and active participation in all aspects of society. A state should also improve detection and early identification of disease, especially dementia, Alzheimer's disease, and Parkinson's disease, in order to minimize and help prevent dependence. Access to health service should also be improved by providing those living in rural or in remote areas. In addition, a state should strengthen their rehabilitation and rehabilitation of service and programs in order to maintain maximum independence and autonomy of older persons. In this context, much more should be done regarding the use of and access to technology, education, employment, transport, and housing. All of these measures will help to prevent or delay the need for long-term care. Older persons have much to contribute to our societies. According to the Resolution 2420 of the Human Rights Council, which established this mandate, I have been requested to identify both best practice as well as gaps in the implementation of existing law related to the promotion and protection of the right of older persons. In addition, I have been tasked to raise awareness of the challenge faced in the realization of all human rights by older persons and to ensure that older persons receive information about those rights. In the exercise of my mandate, I will address the multifaceted aspect of care of older persons as one of my priorities. For that, we will have to overcome one important challenge, the lack of data and analysis for the effectiveness of policy. Therefore, I will need to support and cooperation of everyone, including state, the United Nations system, regional organizations such as the European Union and the Council of Europe, non-government organizations, national human rights institutions, the private sector, care institutions, health professionals, the academic sector organization for older persons and older persons, caregiver and older persons themselves. I hope that at the end of the event, new initiatives will be followed as part of an ongoing effort to strengthen the protection of all human rights of other persons. I want to finish by mentioning the word of Simone de Beauvoir: one's life has value so long as one attributes value to the life of others. By means of love, friendship, indignation, compassion, those words should inspire our work toward ensuring a dignified life for older persons. I thank you very much.